It's my pleasure to introduce Anne Guenin this morning. Anne is the director of Downtown Daily Bread. She joined the staff of Pine Street Presbyterian Church in 2013. Downtown Daily Bread is a ministry of the Pine Street Presbyterian Church and has been providing services to the homeless community in downtown Harrisburg for 38 years. Downtown Daily Bread provides for the basic needs of the homeless with daily breakfast and lunches, shower and locker room facilities, mail delivery, and a winter night shelter. Downtown Daily Bread also provides a year-round day shelter that provides counseling services and client assistance to the homeless. Dairy Church provides financial support to Downtown Daily Bread as well as volunteers to assist in serving meals. We invited Anne to speak with us this morning to provide an update on Downtown Daily Bread and to discuss the impact of the COVID pandemic on the Harrisburg homeless population. With that, welcome Anne.
Thank you, Craig. Craig has been one of our dedicated volunteers serving breakfast in our soup kitchen, and I know advocating for us here at Dairy Presbyterian Church. I want to thank all of you who worship and support the ministries here. Downtown Daily Bread is thankful to be entrusted with the stewardship of your mission-minded generosity. We do rely on donations from area churches and synagogues, from Carlisle to Hershey. And all of these congregations clearly understand that while their own communities may not struggle with homelessness in the same way as Harrisburg does, nonetheless, it is important to support the work of others where the problem lies, because homelessness and poverty are societal issues. I thank you for inviting me, here I'm gonna switch slides here, to spend some time with you this morning. I have been the executive director of Downtown Daily Bread for 4 years, and DDB, as we affectionately call it, has been at work, as they have said, in the Harrisburg community for about 38 years. It began as a small soup kitchen. I am honored to be able to provide leadership to a small team today of loyal and dedicated staff who serve under very difficult conditions every day. If you think about it, we are both a restaurant and a hotel of sorts. We serve food every day and provide a place for showers in the morning and rest at night. We are a post office and a counseling center. In other ways, we're like a hospital emergency room, triaging those with mental illness, addiction, and lives full of bad decisions and sadness. We never know what the day will bring, and our days rarely turn out like we thought they would. I'm incredibly thankful to be working in this ministry in what is often exhausting service to others. Downtown Daily Bread is a gateway to basic human services for hundreds of homeless and hungry individuals. We do offer a daily soup kitchen serving both breakfast and lunch, a day shelter, as Craig said, a winter season night shelter, and numerous personal assistance programs. DDB is the community's only indoor, safe, welcoming resource center for all homeless individuals. Under one roof, clients can access clean bathrooms, warm showers, storage lockers, clothing, mail delivery, sleeping cots, food, computers, library books, telephones, and very importantly, e-charging stations. Most homeless folks do have phones, and that is their main mode of communication to counselors and other services. Individuals can connect with other community resources and experienced staff, and they also find compassion and hope inside our building. I think it is useful to have some idea of the numbers and the backgrounds of people who seek our help. Last year, we served more than 45,000 meals, hosted more than 20,000 visits to our day shelter, and about 4,200 to our night shelter. Annually, it adds up to more than 75,000 points of service, we call them. The people we serve are 55% Black, 8% veterans, 15% women. Some are chronically homeless, living on the street for more than 3 years, which is basically the HUD definition, but some of our clients have been coming to us for more than 10 years, and others are just passing through. There's mental illness, addiction, diabetes, there's hunger, poverty, frustration. The woman who comes to us with a colostomy bag, the man who has bed bugs in his belongings, the woman who has just been released from prison, the man who has lost his photo identification, and the teenager bouncing off the walls because he is high on space, or K2. This is the inside of our day shelter. We open our day shelter at 7 a.m. every day, as well as our soup kitchen to serve breakfast. On many days, we're full by 7:45. People begin to stream in to pick up their mail at about 8:30. About 250 people are registered to use our address to receive everything from food and Social Security benefits, welfare correspondence, bank statements, and letters from loved ones who are in prison. At 9 a.m., the showers open and clothing and other personal care items are distributed. We hand out everything from blankets to shampoo to underwear and socks. We have a staff who help place those who are willing into rehab, who assist with calls to other agencies, and who just listen. We do not operate in isolation, and we exercise collaboration where at all possible. And this is of great benefit to our clients. Many of our clients don't want to go into other office buildings or meet other people elsewhere. So we have instituted a lot of programs where we allow those agencies to come in and meet our clients where they are. And some of them are, we meet regularly with Bethesda Mission and Christian Churches United. We partner with the Dauphin County Health Improvement Partnership and the Capital Area Coalition on Homelessness. In addition, the Salvation Army, the Central Pennsylvania Food Bank, the United Way, Crisis Intervention Case Management Unit, the Dauphin County Bar Association, UPMC Pinnacle, Penn State Health, Social Security, YWCA Veterans Relations, YMCA Alcoholics Anonymous, and the county's Department of Drug and Alcohol. As you can see, there are many, many agencies that are here to help people. And this is a community full of people who are working really hard to help the population. By noon, the soup kitchen opens for lunch, and the day and activities in the day shelter begin to wind down. In the afternoon, we focus on outreach, sending a counselor to homeless encampments, providing transportation for folks to obtain photo IDs, and connecting with other agencies, including allowing some of those agencies, like I said, to come inside and meet with people. At 7 p.m. the doors to the night shelter open, welcoming men to sleep for the night until another day begins. So our building and what we are doing in our mission there is almost a 24-hour event. DDB's location in the heart of the city, across from the state capitol, is key to its ongoing mission. It gives homeless people an option other than the city's streets and sidewalks and libraries, Strawberry Square and bus station and train stations, someplace else to go during the day. Sometimes its success is simply in its existence and its ability to feed. I can tell you during COVID, we've had, I would say, a slight downturn in the number of homeless coming to us. And there's some reasons for that, which I will get into later, but it's not how many we serve, it's the fact that we are always here and that people know that our doors are always open. Numbers vary as to how many homeless people are in the Harrisburg area. There are several known encampments where anywhere from 30 to 100 people have pitched tents and moved in. It is remarkable that these tents are just like our homes in some ways. Here you can see a pantry of sorts. Homeless people have belongings and they take pride in their living spaces just like we do. I will never forget personally a visit to one of these encampments where I observed a bookcase in an old warehouse where people were living. And on that bookcase were knickknacks. And there were pictures on the wall of where they were. So to those people, that's their home. Every year in all cities across the country, there's an effort to count the homeless population, and that is something called point in time. And it occurs in one 24-hour period in January. So that is coming up. Last year, the count in our region, which is mostly the Harrisburg city area, was 418. Our numbers indicate that there are many more who access our services, indicating that there are needs related to poverty beyond homelessness. I think it is helpful to understand why some people are homeless. As hard as it is to believe, we have many clients who kind of choose not to be housed, even if housing is available for them. In many cases, mental illness is the reason for that, but there are others, including addiction. And even though some of our clients have the ability to pay rent because they receive, in most cases, Social Security benefits, they would, of course, rather spend their income on drugs, alcohol, or food. We have clients who receive significant benefits, but spend most of the time in our shelter. Another reason that they don't want to be housed is they don't want the responsibility of obligations. They fiercely value their independence, so to speak. So having to pay rent and utilities is perceived as an unnecessary imposition on their freedoms. Finally, when you've been homeless for a long time, you adapt to certain ways and you become accustomed to living your life in a certain way. So many of our clients who do get housing lose it because they can't adapt to being in it. They find that they don't want to be alone, and they end up bringing their former lifestyle into the housing. And in that case, sometimes that means bringing their fellow homeless people in. And that is a recipe for disaster at some point when you have a lot of people living in a small space and bringing their homeless ways in, and especially when drugs are involved. So we have one client who has been in and out of housing 8 times. And you might ask the question, why does this continue to happen? And it should open up a discussion about helping versus enabling, which is a constant struggle that we have to deal with and a fine line to walk. Though when faced with those hard decisions, we most often err on the side of compassion, I would say. I have found it useful when talking with people about what we do to put a face on that discussion. It is easy to get caught up kind of in the abstract and the numbers and everything that we do, but it's always good to remember that the homeless are on a life journey just like we are. So I'm going to tell you just a few stories about some of our clients. Kevin was just released from the hospital following same-day surgery. He has no place to call home, and so the transport van from the hospital drops him off at our day shelter. His belongings include a thin wallet, a hospital gown, and pants. He is exhausted, and we welcome him and listen to his situation and help him to find a cot. While Kevin sleeps, our team finds him clothes, calls his caseworker, and puts together emergency shelter options for him. And since it's January, he then stays in our night shelter. I cannot tell you how many times that we become the drop-off point for people on their journey from one place to another, including hospital emergency rooms, rehab, or prison. We become the drop-off point. Another story. After breakfast in the soup kitchen, Derek stops in the day shelter. He sits down at the welcome desk and says that yesterday's conversation about rehab really struck him. He tells the staff, "This doesn't have to be the way my life ends." After a phone call to a caseworker, Derek is picked up right outside our door and transferred to a rehab program funded by his insurance. It's his third time to go through this program, but we're always hopeful for him. No matter the outcome, DDB will be here to celebrate or help him once more get to this next step. The problem that many of our folks have with rehab is that they go and do it, but then they're put right back into the situation that caused the problem in the first place. And it's just a never-ending cycle. Another story, every day at 7 a.m., Charles and his many bags wait outside our doors for them to open. He has come here for years, more than 10 years, eating lunch in the soup kitchen, taking showers, picking up his mail, storing his belongings in our lockers. He talks with the staff, and he has built a trusting relationship over a very long time. When we ask him about replacing his broken glasses, he agrees. He didn't agree last year, but he agrees now. After some research, we learned that his new pair is covered by the medical benefits he has, and we arranged that appointment. His sight is clear again, not obstructed by the tape that held those glasses together for months and months. One last story. Rachel and John are always together, socializing with others in our day shelter. DDB staff attempt to help the couple with their most basic needs, but now Rachel is pregnant with their first child. It was her birthday last month, and John treated her to a plate of fries and wings. Thankfully, we know she receives prenatal care. Yet without proof of a home and ongoing baby essentials, it is unclear whether she will be able to provide for her newborn and what will happen with that baby when it is born later in the summer. Being in service at Downtown Daily Bread has been transforming. I see daily struggles that I could not have imagined. Just the other day, there was a grown man sitting on the curb sobbing because once again, his Social Security benefits had not shown up in the Daily Mail. Or there's a woman who comes to us for a laundry card because she hasn't had clean clothes in weeks. Or the man who stands in front of us wanting to take a shower with lice visibly crawling out of his collar. The woman who finally gets a job but has no shoes. These we can help, and we do. Others are harder. The man who destroys the sink in the restroom, or the one who bullies the others while waiting for the night shelter to open, or the one who urinates in the stairwell simply because he is having a bad day. I've had conversations with many of the people who stay with us, and they're mostly one way, and they go like this. Hey, John, where do you want to be? What do you want to do in a month or a year? And time for homeless folks is a very different concept than what we think. Sometimes we have to put people out, take a break from DDB because they do things that are like urinating in the stairwell, which is a health and safety concern for everybody else. And you could ban them for 1 day or 30 days or a year, and it wouldn't make a difference. They live in that moment. So we always have to look at what is the penalty and what is it, how will they change if we impose some sort of a timeout. All of these things, though, bring into focus poverty and people and advantage and lack of opportunity and race and discrimination. And those are big, big issues that we can't fix by ourselves, but we can be a place where people can come. This young lady in this slide is an employee of Pinnacle, UPMC Pinnacle, even though she's wearing a Penn State mask. Those masks from Penn State Health were donated to us in backpacks that were full of socks and other personal items right before Christmas. So she must have grabbed one of those, but her job is to be out in the field and attending to people's medical needs and trying to get them appointments, even if they live in an area like you see here. This is one of the encampments down by PennDOT. So you can see the bridge there. I think that's under 83. But her job is to go down in there and see if she can get people to come out for medical reasons. We work very closely with her. Whoops, sorry. This is another area where we would send our counselors. It's hard to believe that people live like this. I can tell you just last week, there was a fire in one of the encampments that was burned the tents and all of the belongings of the people who lived there. It was intentionally set because someone was mad at someone else, most often over drugs or boyfriends. And so we sent a counselor down in there, got a list of what they needed, and were able to resupply some of these tents. Suitcases are big items that people need to carry their stuff around. A lot of people are at this point hesitant to leave these encampments for a couple reasons. There's not that many places to go at this point. They are afraid that when they return, their belongings will be gone. And even if they were able to carry all their belongings, their space, their spot where they sit would be gone, or where they pitch their tent would be gone. So these become kind of communities unto themselves. I think if you read the piece that Penn Live did, they talked about one fellow who comes to us for his mail, and he's called the mayor. And they kind of set up their own quasi little governments in these areas. But they are tough places to live, as you can see. And, you know, you would think that they would want to come out and do something better, but this is where some people are right now. So you can see just the utter despair and chaos of life when you're living like this. This is a woman who does come to us regularly. So I will have a few brief words on COVID and its effects on our organization. Last March, we were forced to close our shelters. I believe it was March 13th or so. And there was one day, I believe it was the 11th, that we closed everything except lunch. We have never missed serving lunch through pandemic or storm or whatever. In 38 years, we have never missed a lunch. But we did close everything else, and we quickly discovered that was not okay, mostly because of the mail situation. So people needed to absolutely continue to get their mail. So we opened up for services at our front door and allowing people to kind of check in, get mail. And at that point, you know, we were giving out clothing and tents and towels and blankets and all sorts of things. We reopened the shelters in July. And at that point then we had, as you saw in some of those slides, installed plexiglass and created pods with screens and cleaning everything. We actually installed some air purifiers in the heating and cooling systems. And we have portable air filter units on the floors in the shelter. So we've had to kind of retrofit everything to operate under the COVID limitations. We reopened, during all this time, we were serving our meals to go. So unfortunately, we became a big user of styrofoam containers, but that was the only way that we could get food out the door. We reopened our dining room in October and have limited seating in there. And Craig knows that we opened breakfast too inside. And we're doing it with limited and actually at this time, no volunteers. The goal that I had to adopt through all of this was to keep the staff safe as possible, because if the staff were to come down, any one of them with COVID, then we would have to close all of our operations. So we did the best we could. We haven't been, we ask clients to wear masks when they're walking in, but when they're kind of in the space of the shelter on their cots or eating, of course, they're not wearing masks. So again, what could we do to keep the staff safe so that we could keep operating? Amazingly, unfortunately, we know of no COVID cases among the homeless population that we serve. Other agencies in Harrisburg, I know for certain, have not been so lucky, especially ones that have residential facilities. They have some people who are coming and going and then living all the time in tight quarters. Some of their people work and have brought COVID back in that way. So they've struggled a bit. But early on, we think one of the reasons that our population hasn't had COVID is because under guidance from HUD and from the CDC, there was an effort to keep people down in these encampments of all things. So this is the first time that HUD has said, no, keep people down there, and we're not going to try to move them around or get them shelter or housing, keep them where they are. And so what they did was they put porta potties near these encampments. They put faucets on the hydrants so that people could have fresh water and showers. And then what all of the organizations similar to ours did was send people down into the encampments with food and clothing and other services. So we were meeting people where they were. So the effect of that was that people weren't moving around and interacting. They were in their own pods, just like your families. These were their families. And so fortunately, that seems to have worked. And we are grateful because I don't know, there aren't other places where they can suddenly pop up a day shelter. There is another night shelter operating now for overflow because COVID has limited our numbers. In the night shelter last year, our max was 40, and this year we're at 27. We just cannot accommodate safely more than that. So I think from what I can see, a lot of the homeless people have accommodated to COVID and figured out other ways. And we are not at this point busting at the seams, even though we're allowing fewer people in. So finally, I just want to say a few words about our funding. We are blessed to be supported by many generous individuals and businesses, foundations, and other organizations. As I said before, churches. There are a few family foundations in the Harrisburg area, but mostly I have to say, this area has been just overwhelmingly generous, and it really is an inspiration how thoughtful and kind people have been through, especially through COVID. It's been an outpouring. We had to set up an inventory room for all of the donations that we received because we got so many, and especially in the beginning when we had to handle them carefully. So that has allowed us to dream, and I'm hopeful next year that we can add some new positions to help serve. As I said, the beauty of what we do is that we're there, and so our biggest assets are our staff, and staff who are willing to go down into these areas, and staff who are willing to sit and listen. So I thank you, Derry Presbyterian Church, for your part in this mission. So if anybody has any questions, or if your perceptions have, our perceptions of what is going on are different than what I was able to say.
Yeah, I have a question, Anne. This might be beyond your scope, but like that last picture you had up, it seems like there's unsanitary conditions with all the trash around. Has there been any effort by, say, the city or anybody to place trash cans out there, or how do they clean up those areas?
There
I would think that's important to do.
It's very important. And I would say during the summer and into the fall, there were trash. And that is one thing we've been working on for a long time, not just since COVID, but if we could just get the city to run a trash can or a trash service down in there, that would be ever so helpful. I've heard, though, that the trash cans have disappeared. So unfortunately, the trash that can be collected by the city, the receptacles are pretty far from where this is. So it looks like this person absolutely does need some help in cleaning this up. That is not human living conditions, as you can see. Yes, it's a big problem, but I have to check because that was someone who was down in there last week about why they would remove them at this point if our goal is still to keep people not moving around. So, yeah, that's horrific.
Are you able to write for grants?
We write a lot of grants. So our funding, as I said, there are some family foundations, but we get support from everywhere from Highmark to Penn State Health. There are other businesses, but we've been very successful in writing grants. And as I said, the community has been incredibly helpful.
Very good. Someone else?
Yes, this is Bruce McKinney. First of all, thank you very, very much for coming and in all means for what you're doing. That's absolutely great. As you look towards the future, what are your two greatest needs?
Two greatest needs. Well, I'd say our number one need is making sure that we have enough staff to respond. And we've gone through some changes recently, so I'm a little short-staffed right now. So we want to make sure that when people come in and are actually willing to ask for help, that we can provide. It takes a long time to sit with someone. I mean, think about, I know someone who recently had to fill out their Social Security application to get benefits. So think about if you're a homeless person who is living like this woman here, and you can, you might be able to access some benefits, but you need help sitting down and filling out that application, or you need someone to come beside you on the telephone to help you navigate, or you need help to get a ride to a doctor's appointment. All of these things are incredible barriers. And so that is one thing that I want to look at. And because of the generosity of the community, I think I can do that this year. That would be one thing. And then it's just keeping people informed about what's going on. One thing that has come out of COVID that has been absolutely wonderful has been increased collaboration of all of the agencies in the community. So I participate every Wednesday morning in a telephone call that has been going on since March. We have not missed one Wednesday morning. And on that call is, which are facilitated by CASH, which is the Capital Area Coalition on Homelessness, are all of those agencies that I mentioned earlier. And knowing what everyone else is doing has been wonderful. And it helps us know where kind of we stand, and it helps us fill in the holes. And so I hope that openness, and also the openness of the city to recognize that we need to help people where they are, I hope that continues.
Thank you.
Many thanks for your good work. How much help will you receive from the city and the county in terms of your mission?
We as an agency, we don't get, at this point, we don't get any city or county funding. Specifically, I can say that we were able to write a grant to the gaming board. That was last year. And they helped us with some of the costs of our air conditioning, which I know was also discussed in your mission committee at Derry. We don't get a lot of funding. One of the reasons is that we are not a separate 501c3. So we operate under the auspices of Pine Street Presbyterian Church. So we are a religious organization. The other thing that happens when you take that kind of funding is that it puts an incredible burden on our organization to do some reporting and data. And everything in that funding is dependent on what data you give back to them. And that overwhelms us sometimes. And so we're trying to find some ways that we can participate in that. But for right now, I've found it more of a burden than to be helpful. I can say we did have a position that was a mental health outreach counselor that was funded through the county's mental health unit, partly with federal and partly with state funding. I know the city is thankful. I've been, I was on a Facebook Live event with the mayor in December, and because of COVID, we have a lot more increased communications with both the county and the city. But so far funding has not flowed, and so far we've been okay.
How do you get, you said you give away clothing and all. How do you get clothing? Do you go to some of the other charitable places that have excess clothing, or how do you get it?
A lot of people donate. There's a lot of people who clean out their closets, and people have been very busy during COVID doing that. So people, our doors are open in the morning, kind of as a reception. There's a reception area, and people just drop off things between 9 and 12. All sorts of things: shoes, belts, coats, pants. We also have a wish list on Amazon. And so if you go to our website, you can click through to a wish list, and then people can go right to Amazon, buy things, and they're shipped right to us. That's been very good. And then we also have, if you can imagine, every time someone takes a shower, putting back on the underwear and socks that they had is just not a good option. So we hand out an incredible amount of underwear, particularly men's underwear. And I have certain people, I call one person the underwear man, where I can go for funding for underwear when our supplies get low. We do coordinate with the other agencies, but mostly like to even things out. We get a lot of people will donate women's clothing or children's clothing or dress clothing that we can't use. So we work with community aid, and we work with Bethesda Mission to kind of move supplies, and the Salvation Army, and to move supplies around that maybe they can use that we can't, and vice versa. So we've found that people like knowing it. Sometimes people don't want to just give to an organization, they want to give for something specific, and it's identifying who those people are. And so if you can say, we need 3,000 pairs of underwear, that's how people want to help sometimes. So we just make sure we know who those people are.
Anybody else?
And I'm just wondering, along with those direct donations of clothing, can you also take canned goods?
We can. I can tell you a little bit how we get food. Most of our food comes through the food bank, the Central Pennsylvania Food Bank. We also get food from, again, just like clothing, other agencies, and we move a lot of food around between us. We do take some individual canned goods, and those we use to kind of set up our own pantry, so that if a client comes off the street, and especially a family or women who we wouldn't want necessarily sitting in our soup kitchen, we can hand out food like that. We hand out vouchers. We're one of the voucher places where people can get a voucher and then go to the food pantry to get food. Individual donations of canned goods, though, when you think about it, every meal we prepare is for 100 meals, let's say. So if we get individual small cans of food, it's hard to use those sometimes. It's much better if we would get, like those number 10 cans that you see at Costco or Sam's. Those are more useful to us. But food, surprisingly, is not a large expense for us. When I first started 4 years ago, we were spending up to maybe $20,000 a year for food. But if you work things right, you shouldn't really have to spend any money on food, because you work through the food bank through their grants, and we do get state grants for food through the food bank. And then you work through donations. So I think every once in a while there's something specific like spices or other things that the food bank says, no, we're not funding those things. But I think I've got our food expenses under $2,000 or $3,000 right now because food is plentiful. If you're homeless in Harrisburg, you should not be hungry because there is so much food. There are 5 meals a day that are served everywhere. There's people who actually take food down into those encampments, and there is food everywhere. So that isn't the problem. It's just getting to it sometimes. But that isn't one of our, now running the kitchen, I had a grantor recently who said, I'm only going to fund food. And I had to go back to that foundation and say, but I can't, if I don't have anybody to serve the food, I can't serve it. I could have food and I could use your funds to buy food, but the biggest expense is opening up the dining room and paying the staff to serve it and heating the space and all of those things. So I was able to get that foundation to agree to kind of a food operations grant. And that's what it was, because it's not the food itself, that's the expense.
And it's wonderful what you're doing. I really admire you and all the people that are doing those things. I heard you mention along the way about people's insurance. I'm kind of curious about that. What kind of insurance do they have?
They have medical benefits. So that's the main thing. So they, there's those open enrollment periods kind of that you hear about and all the time. So a place like UPMC and Penn State and Aetna, and I believe there's 2 others, actually are tasked with signing up as many people on that end of the spectrum as possible. So we have, I think that, in order to operate, that they have certain mandates that they have to, have certain number of people in homeless situations on their rolls. So we are, before COVID, we're inundated with insurance companies and representatives wanting to come in to sign up people. So once people get insurance, then it's what they do with it. And under that insurance, they would have a primary care provider, just like you would, and where they go. I think the impetus for this is that if, say, UPMC can get someone on insurance and getting them going to the doctor, then they won't see them in their emergency room, where it becomes much more expensive to treat. So, the guy with lice, if he'd have been going to his primary care provider instead of showing up in the emergency room, which is what he did, to get a shower and clean clothes, that's an expensive proposition. So there's some incentive then to get people insurance benefits, and they're available.
And they pay for that through their Medicaid, or how do they pay for
or it's
that?
getting paid for. It's getting paid for through, these people don't have any means, so no one's paying anything. I do know in some cases they have copays because we do help with that sometimes. If someone's going to a clinic and they need a copay, occasionally we help with prescriptions. When you think about it, though, when someone comes to us for $10 to get their copay on a prescription, I would think our stance should rather be, we just are very thankful that person is taking the medicine instead of having them pay a copay, which to many, if they don't get to us, they won't be able to get their prescriptions. So, but that's a problem I can't solve.
I can speak to that a little bit, being a retired broker. Medicare Advantage that's out there is for 65 and older, or people that have medical disabilities. And you can get a $0 premium Medicare Advantage plan, so it doesn't cost you anything. And then if your income's low enough, you can also waive the Part B premium to the government. So I've never thought about it in this situation, but I would imagine there's ways to go ahead and get medical insurance for free to a lot of the people.
Yes, absolutely. And like I said, they crawl over each other to get in to do it. So I'm thinking there's some mandate somewhere. I'm not for sure, but I'm thinking.
So is that what funds the nurse from Pinnacle in the encampment?
Well, that position, and there are others who also work in their community services. No, that, I mean, Pinnacle funds that. And like, you know, if you can keep someone out of the emergency room, then that person will pay for themselves many times over. That's an invaluable, before COVID, that person sat in our facility every Wednesday and helped people get their appointments, made sure they were going, and got them insurance and, you know, whatever else they needed. And that's only good for the community and good for the hospital. And UPMC has been, you know, they've been a funder of ours too, because they recognize that that's a good thing. The same with Penn State Health. We work with Penn State comes in and does flu shots for our clients. They'll do other, they did other things. They had people coming inside, some nurses. We've had their chaplain program inside our facility. So anything that we can partner with that helps people, I'm open to.
Define a little bit your relationship with Pine Street Presbyterian.
The downtown Daily Breads.
Yes.
Yeah. And mine personally too, actually. I'm a member of Pine Street, and I started out 7 years ago as the church administrator, of which I still am. So I have two hats there. Downtown Daily Bread started out as just kind of a soup kitchen and then grew. So all of its staff now are actually, there's one payroll. So we're all employees of the church right now. As I said, this sometimes causes issues with funding. It also causes some confusion for people who think they're donating to a church and might necessarily not want to do that. So, you know, we've tried to have kind of a wall of separation there. Sometimes we think about it should be its own entity. And, you know, that's always something to look at and investigate if it gets so big. And right now it is. It's, you know, it just used to be this little thing over here on the side that was nice to report about, but it's kind of taken on a life of its own. And so, you know, I think the church needs to make some decisions about what its future is going to be. And it could operate on its own. The building where we are is the Boyd Memorial Center, which is owned by the church. So Downtown Daily Bread technically pay some rent to the church, which is just a way of us keeping track of costs. So for instance, if there's a leak in the roof in our building, well, the facilities manager of the church comes over. So that's something that, you know, you would get if you were a tenant, your landlord would come in. So just to kind of keep our cost centers separate, we do that. We separate out all of the expenses, and the payables and the donations are all tracked separately for that. And we designate within our endowments and funds specifically what has been given to Downtown Daily Bread. So we're audited every year, the church is, and they do a separate audit then for the activities at Downtown Daily Bread, just to assure everyone that it is separate and there's no kind of commingling of funds or use of funds by one or the other.
Okay, we are past our 45-minute allotment, but I didn't want to cut off the excellent questions. Everybody who's listening well and asked, like I said, really good questions. Anne, want to thank you for being here and explaining the program and the situation around Harrisburg. And it was an excellent presentation, gives us a better understanding of what's going on and an updated understanding. So on behalf of Derry, thank you for being here and making such a presentation.
Well, thank you. It's always good to let people know about what we do and mostly about the people that we serve. So,
And I'll put a
very-
plug in for Mission and Peace Committee, who actually arranged for this. So they did a real nice job in getting Ann to be here. So appreciate all your efforts. Thank you.
Thank you.
Thank you,
very much.
everybody.
Thank you.
Thank you.